I think insurance has to get out of it, traditional insurance. And one of the fixes would be to use a health sharing program. And they are wonderful because consumers get to pick where they go. The health sharing program doesn't. And when consumers pick, everybody wins. That's not what happens in healthcare. Yeah. So, in my chapter 6, I'd go over a 6-step solution and paying cash for healthcare and actually consumers using health sharing programs is one of the fixes. So you're really, go ahead.
And I have to say all the time, Shawn, I'm not anti-insurance in the sense that people do need catastrophic coverage, right? If you get a cancer diagnosis or you're in a bad car accident, you need catastrophic coverage. Now that can come to you through a traditional insurance product, or it can come to you through a health share. I too am on a health sharing plan, and I also love it and recommend it frequently to people. But the key is, it's catastrophic coverage, and for the daily maintenance and healthcare, those are services that people need to shop for, and ideally do it in a price transparent way.
Well, and like you said, and a lot of people just don't realize this about healthcare. And I think it's partly because the media and the government wants to portray healthcare as it has to be expensive, so somebody else has to pay. And that, most healthcare is emergent. And like you said, 85%. And I think Keith Smith quoted that same thing one time, but also behind that, he said, at least. And if you think about it, most healthcare services are not emergent. And the routine stuff, doctor's visits, regular labs, pharmacy stuff is not expensive. Yep. And it would be a lot less expensive if people paid cash up front. So there's not that middle person involved in it. So
that's exactly right.
You give an example of the hysterectomy that's $7,700, and that's a chunk of change. There's no doubt about it. Mm-hmm. But let's just make a comparison of if you're in a health sharing ministry versus traditional insurance. Traditional insurance for my wife and I is going to be like $1,500 a month. Yeah. We pay $150 a month for our health sharing program now, which means we save $1,200 a month at least, right? Yeah. We could pay for a hysterectomy every year.
Yeah. And have plenty of money left over.
Exactly. And people don't realize what a ripoff, traditional insurance is. You're paying for something you don't really use that much. And if you're getting it from your employer, and I'll have you speak on that because you guys market to employers also. If you're getting it from your employer, the employees also get ripped off because that money could go to you in your pocket if the employer wasn't paying $1,500 a month.
You got it. I had a similar situation, Shawn. I had, traditional insurance coverage with my prior employer, who I left to come to Fair Market Health. And for my family of 4, we were paying $1,600 a month. And now with the health share plan that I'm on, same deductible, by the way, I pay $400 a month. So I'm basically paying 1/4 the price, and same thing. I'm saving $1,200 a month, which if my math is right, that's $24,000 a year of savings that stays in my pocket and is available for me to help to buy healthcare.
Yeah, exactly. And then you get to choose what services and where you want to go. That's what's so important. Let's talk about the deductible in health sharing programs. I'm not sure what the program you're with, but ours, for instance, we have a $5,000 deductible. Yeah. And when we go and have any kind of services, like my son broke his leg 2 years ago, compound fracture, it ended up being $48,000. And there were surprise bills all over the place from the doctor, from radiology, from many different places. And, I'm friends with Dr. Smith, fortunately. And I just said, hey, Dr. Smith, what would it be there, in Oklahoma? He goes, well, hardware and all, it'd be about $8,000. Wow. Right. And typically, if you look at these numbers, Dean, kind of like your hysterectomy comparison. And Dr. Smith's the one that educated me on this. It's usually about 8-1. And look at the hysterectomy, 7,000 versus 50,000 plus.
Yeah.
About 8-1.
Yeah.
So anyway, I negotiated a price with the hospital. I negotiated a discount, and any discount I got negotiated was taken off on deductible. So I negotiated a 20% discount, and so it was a $9,000 discount, and so my deductible was $0.
Wow,
that's
awesome.
So I paid nothing, and within a week after negotiating, I told them I was all done. Within a week, I had a check in my hand to pay the complete bill off.
Yeah.
They're amazing. Insurance companies do not work like that.
Right.